let's jump right into the video for everyone. So let's briefly explain what degenerative disc disease is, and we'll keep it to the low back, like I said, for this purpose of this video. And then I'm going to give you some practical advice, some healthy tips going forward to help you manage this. So, what we got going on with degenerative disc disease? Almost no medical professional will disagree from what I'm about to say, but in terms of causes and solutions for degenerative disc disease, we tend to differ quite a bit. But that being said, here we go. We have the spine up here. Here's your skull. Runs all the way down, and then here are your hips. Okay. What's often going on with degenerative disc disease is you'll look it up in the medical literature, and they'll say normal degeneration that's occurring to a joint due to wear and tear and stress and time and everything else. But my challenge for that statement is the normal. If that's true and it was normal wear and tear, you would see that normal wear and tear at every single joint in the body. How come you only see it maybe here, or maybe in your knee, or maybe this hip? Why is it not every joint in the body? So that's the million-dollar question I pose to people who say it's normal. More than anything, you can call this my belief, but more than anything, what's happening is it's not normal to every single joint. It's only on the areas where you have the most stress, where you have the most wear and tear, where there was a problem and it was never fixed. Okay, that's the caveat. You had a problem in that area and it was never fixed due to repetitive traumas, due to you had an injury to that area and you never properly had it worked on by a medical professional or rehabbed, or all the above, and it was left to just degenerate and wear over time. So here's what's going on in that process. We'll pick any joint in the body, it doesn't matter. What happens when you have injury to this joint, whether it's due to an accident or, like I said, repetitive stress, or maybe you slept wrong repeatedly too, that's part of the repetitive stress. Basically what's going to happen to that area is your body's going to go, I need to protect this area, I need to protect this joint. So what I need to do is I need to lock it down to try and stabilize this area because it's unstable. So what it will do during that time is it's going to recruit muscle, it's going to recruit these other tissues to come in, lock down that joint and keep it from moving anymore. Okay? That's a good short-term solution. Your body's doing what it's supposed to do. It's trying to protect that area. It's trying to keep that quote-unquote unstable area, which your body feels is pretty unstable. It's trying to keep it as stable as it possibly can. Okay? That's good short-term. We're talking hours, days. Now, when it turns into weeks, months, years, that's when you're going to run into that degeneration. And here's how. If that joint's not moving the way it's supposed to and the way it's designed to, it's going to start to wither away. The disc, you can look this term up. It's a term called imbubition. Okay? I-M-B-U-B-I-T-I-O-N. Imbubition basically refers to the disc, their ability to get their nutrients. So when a joint's moving like it's supposed to, you're allowed to turn and twist and do everything you're supposed to do. When that joint's functioning and moving like it's supposed to, no problem. All the nutrients you eat and drink get sent to that area and that disc stays nice and healthy. Now, days, weeks, years go by of your body locking down that joint and it's not moving because your body thinks it's unstable, is going to cause that area not to get the nutrients it needs. That disc will not get the nutrients it needs, so start to shrink and die, just like you and me if we weren't getting the nutrients we needed. Okay? So that's when you run into that problem. You look up any picture, any infograph on degenerative disc disease, you're going to see that disc is really shrunken, you're getting bone on bone, everything looks jagged and not nice, and it looks inflamed and heat and painful and everything else that you get in the area. That's how this process started, where the whole time is your body locked down this joint to keep it from moving anymore. The disc shrunk and died. Okay? What's going to start to happen is your body's going to start to have a natural response to this. It's going to go, hey, things aren't going well with this disc, I need to do something. You're going to have the inflammation process, swelling, everything else that's going to occur in that area, which the swelling, inflammation is going to damage tissue. Your body's going to start laying down scar tissue in these areas. You're going to get lack of movement. It's going to get harder even to move, and then that scar tissue is very disruptive, and it'll beat up the tissues in the area a lot quicker. And depending on what's going on, depending on what you did to that area, whether it's trauma or repetitive stresses from work or life or lifestyle, whatever you're doing, you can tend to have irritation on the nerve. So a lot of the medical sources you can look up, don't just take my word for it, a lot of the medical sources you can look up, basically you're going to have irritation on the disc and you're going to have irritation on the nerves of the cord itself, and that's what gives you the pain. I agree 100%. So what we need to do is we need to get rid of those causes that are causing that irritation and the causes that are causing that joint not to move the way it's supposed to, and then thus leading to that degenerative process. So that's where somebody like myself comes in, and we're very effective as, in the medical world, they want to manage the pain. Or you come in and they say, oh, it's degenerative disc disease, not much you can do about it. See a physical therapist if you want to take ibuprofen to bring down the inflammation. All that is just kind of managing the symptoms, okay? What we need to do, like I said, we need to get back to the root cause of why this area is in trouble and why you're having that degeneration in the first place, and that is the joint not moving the way it's supposed to. So what I do as a chiropractor, we are the best in the world at getting joints moving the way they're supposed to and trying to keep them moving. So that's my main goal when you come in is, let's get this joint moving, let's get that imbibition going again, let's get those nutrients going back to the disc so that we can keep the disc as healthy as possible. Nothing on the face of this planet can restore disc to its glory days. So once that disc starts to shrink and die and you're getting close to that bone and bone, there's nothing you can do about it at that point. It's more managing the problem. So you don't want to wait till it gets that bad, okay? But what we can do, what chiropractic has shown to do in the research, is halt that process from getting worse, which is the key point to that. Is it's never too early to start. It's never too early to find these areas that aren't moving the way they're supposed to. Keep them moving so you have a nice, healthy joint. The disc, the nerves, the tissues, the muscle, the bones, everything can be as healthy as it can be because it's moving and working the way it's supposed to be. So that's me. I'll get off my pedestal about what I do as a chiropractor and what I do as a professional to help restore this area and prevent degenerative disc disease from occurring. Now, once it's set in or that you have this process going on, there's a couple different things you can do. So I want to give you a couple tips. A lot of it is lifestyle changes. Some of them are exercises you can do to help manage the pain or help try and get as much motion in these areas as you can, because that's key importance. Another thing you can do really quickly is keep the inflammation down. So I alluded to that a little bit already. That's what people try to do with ibuprofen when they prescribe ibuprofen, or something stronger than ibuprofen, is control that inflammation, because when inflammation runs rampant, I want you to think of inflammation as like a fire. When it's left burning in the fireplace, it's beautiful, we all love it, okay? When it starts to run rampant and we don't do anything about it, it's a fire that burns down this whole building that I'm in. You don't want that happening. Same thing with the inflammation. You need to control it. That will help control the pain and help control the situation that you're in. So there's natural options out there too. There's pharmaceutical grade supplements. As far as one that pops in my head is turmeric. Something that's going to anti-inflammatory, antioxidant, that's going to battle the damage that's being done in those areas. Message me, reach out to me if you want a couple other good ones. I have access to all these. They work just as good as ibuprofen without all the nasty side effects. So something like that is a good way to battle and manage the inflammation that is being processed in that area. So let's jump right to it then. I want to give you a couple things that you can do on your own to help manage or keep this from happening. Okay, so first thing, lifestyle changes. For most of us, we have desk jobs, okay? I even do it for a lot of my day. First thing you need to really focus on is your proper posture when you're sitting at a desk. I don't have a good chair or good way of showing you in this room because I'm about to show you some exercises. But basically what you want to do is you want to sit as tall as you can. Sometimes the mistake people make is they try to sit back because we're hunched over at a computer all day like this, and that hunched over is causing a problem in that low back, mid-back, neck, other places. So then we try to overdo it. We go, oh, I need to sit up straighter, and you sit way back like this to the point where now you're just stressing the low back in other ways, okay? So what I recommend is sit tall. Sit as tall as you can. And I was told this in school, and I really like this, and I run with it, is act like there's a string tied to the top of your head that's pulling you up so that you're sitting as tall as you can and you can't help it, okay? So if you're in a chair, don't slump, don't have the shoulders roll forward, and don't squeeze the shoulders back so much that you're going to cause more issues in those areas. Instead, find a happy medium. Let the shoulders relax. Sit as tall as you can. And if you need to have a nice support back there, have a nice support. You can buy support pretty cheap. You can roll up a towel, something along those lines to help in the lumbar area if you need it. But the other tip I have for sitting in the low back, sit back against the chair as far as you can before you sit down in the chair, and then sit up as straight as high as you can. That will help keep you from relying on the back support too much on chairs, because oftentimes the back support is not adequate and it's not perfectly contoured to adapt and support the spine that you have. So I don't recommend necessarily sitting back against the support the whole time, or at least a long part of your day. Try to sit your butt back as much as you can, sit as tall as you can, relax the shoulders, and you'll notice right there, just by doing that, you're going to take a lot of tension off the low back and off the other parts of the spine just from doing that. And then, the other tip is kind of a no-brainer. Try to get up, stand, walk around, get some movement in that area. I'd say once every 15 minutes is ideal, just to keep those discs moving, just to keep those muscles loose, just to keep the tension down. But apply those practices. Don't be discouraged if you keep going back to your bad posture ways. You need to do something, 1,000 times before it becomes second nature. So just keep making the corrections. Find yourself doing something bad, correct yourself, do it the right way, keep doing it repetitively, and it'll start to turn more into a habit. Okay? So that's more preventative, okay? Now a lot of stuff, if you're having back pain, whether it's due to degeneration or some other reason that we're not talking about in this video, some exercises, some things that you can do going forward, pretty simple. First ones I'm going to give you are called the McGill 3. So Dr. McGill is a very, very, very famous and well-respected doctor. Not necessarily a chiropractor, I'm not saying anything about that, but he's a well-respected doctor in the physical medicine industry. And almost any provider, whether it's me or a physical therapist, you name it, we all know who Dr. McGill is. So these are the exercises he really found to be the most helpful for these situations. So these are the ones I wanted to show you. And then I'm going to show you an extra bonus one as well. So the first one is it's called a McKenzie exercise, okay? What I'm going to do, I'm going to turn this a little more so we got a better view of the table here. So basically all you need to do as a patient, you come lay face down on the table like I am right now. You know, you can start off on your forearms, that's kind of the easier way of doing it. And if you start to realize you can do this even easier without pain, then you can move up to your hands like you're doing a push-up. But we'll start here. All you do is you lay face down all the way, and then you're going to come up on your forearms, arch your back as far as you can. Now if that's easy, then you can go to the push-up type move, come up here, arch your back as far as you can, and come back. So my warning is you don't want to go up as high as you can and hold it for as long as you can. That's not how this works. It's more the repetition of you coming up and down, up and down. So what we're doing, we're getting those joints to open and close as you go from the certain laying down to more of that arch, laying down to more of that arch. That's the important part. We want to get those discs moving. We want to get those joints moving like I stressed in the beginning. This is a very good exercise for doing it. This is one of the first exercises I give my patients as a way of managing pain. This exercise is very helpful at managing pain, and it's something pretty easy that you can start implementing. And let's say you don't have to come see me all the time to get a joint moving. You have a way of getting that joint moving, and exercise to help get that joint moving without having to see a chiropractor or a professional every single day of your life. So that's the first one I would start with as far as the low back goes, and if you think the problem's right in here, okay? Other one I recommend, this is more of an exercise to strengthen your core, these next two are, okay, which is very important because think of your core as like the safety belt. So any power lifters, anyone who spends a lot of time in the gym will know what I'm talking about, but if you're about to go squat a whole bunch of weight, typically you'll put a belt on for more support, okay? That's basically how your core works. Before you move your arms or your legs, without you even realizing it, your core is activated to stabilize the spine because it's all about the spine. So your body wants to instinctively stabilize the spine before you even take a step. That's how important the core is. Now, for most of us, you can just admit it, for most of us, our core is not as strong as it needs to be or as strong as it should be. Now that lends into problems because you're going to lose a lot of stability in the low back and the hips and everywhere else. So what we need to do is we need to strengthen that core as we're getting these joints moving, as you're stretching and doing everything else you're doing to try to help with your low back pain, working on your posture. We need to work on the core. The stronger the core is, the more support you will have. So stop doing sit-ups, okay? Sit-ups are really bad on your back. Yeah, you'll get a nice six-pack, but they're really bad on your back because you're in this constant flexion motion where you're flexing the low back. That makes it easy for that disc to go backwards right into the cord, and then you have disc bulge or other problems like that that can create chronic pain in those areas. So instead of doing a sit-up, I want you to do what I call a modified sit-up. I don't recall what the name is from school, but this is a lot easier on the back, and you'll still get that core strength, that ab workout that you're looking for. So it looks a lot like a sit-up. What you do is you'll get in the same position, keep one leg bent, one leg straight. I'll show you it just like that. The only reason, I get asked this all the time, the only reason you do that is to help keep your pelvis and your hips firmly down on the surface so you're not rolling or doing anything you shouldn't be doing, okay? Otherwise that has nothing to do with the exercise. What you do with your arms, put your hands in the small of your back just like this, and you're going to come up like you're doing a sit-up, but instead of repping it out, you're just going to come up and hold that position. So this is what we call an isometric workout. So instead of working the abs out or the core out like they're a bicep, because they're not and they work differently, what you want to do is you want to work on the endurance of that muscle or that muscle group, the core. So as you come up and you sit there and you hold that, you're working on that endurance, you're working on that isometric hold in that core, which is ultimately going to strengthen the core, but it's also going to improve the endurance, so it's going to improve your body's ability to use your core to support the low back, which ultimately is what you want anyways. And it takes all the pressure off the low back, so you don't get up afterwards and you're like, oh man, my low back hurts after that. I don't know if you're like me. I've been there plenty of times doing sit-ups throughout my athletic career, and afterwards I get up and I have this sharp knife-type pain in my low back, and I have some achiness that lasts days. That's because it's not good on the back. Yeah, it gets you that core muscles, but it's not good on the back. Do this instead, okay? The other one is going to work more on these oblique muscles out here. So you have a couple different muscles in your core. That one I just showed you is good for the anterior aspect here. We need to work on the sides. So the other one he recommends, and I'll show you the introductory way of doing this as well, but this is just a plank, okay? And you can do a front plank too. Maybe we've all heard of that too. That's going to work on the same area I just showed you. But here's a side plank. Beginner's level. Stay on your knees, okay? If it gets easier, it's easier. You can go up to your feet. I'll show you the knees first. But what you're going to do is you're going to get on your side, and you'll do both sides, obviously. But you'll get on your forearm like this. I keep my hand on my hip, and I'll tell you why in a second. And then you bring yourself up like this, okay? So you want to rise off the ground, and you should feel it on the side closest to the surface. Why I keep my hand here is to keep myself parallel. So right now I can see myself in the camera, so I can see if I'm arching up too high or I'm not high enough and I'm slouching down like this. But usually you don't have a mirror of a way of seeing how well you're doing. So by having the arm here, you can tell, hey, my body's nice and straight throughout this plane, and I'm not arching my hip up or dipping down or anything like that. You want to be straight as a board through here. That's working that muscle optimally. So let's say you can do that 30 seconds a minute. It's easy, no problem. You're feeling it more in your shoulder than you are in your core down here. What you can do to make it harder, like I said, get up on your feet. Now you keep that arm straight, keep yourself nice and straight here, and you can just feel it in there, and I can feel it immediately. This is automatically going to make it a lot harder. But that will work on those obliques out here, like I was saying, so we get after the whole core here, so you have the most support in that low back. So that's all the information I wanted to go over with you guys. Sorry, I have one more exercise. I got ahead of myself. So those three, created by McGill, they're endorsed by McGill. They really help people out. The other one you can do, it seems a little silly. We're working on the core, and we're working on some other core muscles that help stabilize the spine. The other one is called a bird dog. So if you're like me and you have a dog and you like to hunt, bird dogs, when they see a predator onto a trail, they'll point their nose and their tail out like this to point, hey, I found the bird, or we need to go this direction. So that's essentially what you're doing in this exercise. You're going to get on all four like this, like a dog, okay? And start off easy, start off small. Keep your back straight, contract your core, keep your core nice and contracted through the whole exercise. And all you're going to do, without arching your back or rolling your shoulders and dipping them to the side or anything like that, the same thing for the hips, is you want to keep your back straight, contract your core. You're going to lift one arm up at a time, and then back down, okay? Then you can do opposite arm too, or you can move down to the legs. So the legs, bring the legs straight up, and then bring it back. Once again, you shouldn't see my hip dipping like this to try and get the leg up or anything like that. This should stay nice and level. You should be able to put something on my back and it doesn't roll off my back or fall off my back at all. So if that's easy and you get there, and guys, speed is not the goal of this. You want to do it nice and slow and under control. But if that gets easy and you're like, oh, I can handle that, no problem. What you want to do instead is make it a little harder and do opposite arm, opposite leg. So you're in the position again. We'll do right arm, left leg, just like that. Now you're pointing like that dog I showed you. Then you'll come back, get your bearings. Now you're going to shift your body weight, of course, but you shouldn't really shift around and change things up because you're contracting your core and you're stable throughout. You'll do the opposite arm, opposite leg that way, and you'll come back. If you do this correctly, this is one of the most challenging and hard exercises you'll do, but it's one of the exercises you'll get the most results from. So those are my recommendations. You have the modified sit-up, you have the McKenzie exercise, you have the side plank, and then you have the bird dog. Those are really going to help take pressure off the low back, work the core so you have more support. Also, if anyone's tuning in late here, other things you can do, work on your sitting posture any stresses you're having, if you're constantly bending over, picking stuff up, you're in a hard labor job, something as simple as, because you're not going to be sitting the whole time, something as simple as using your butt, bending down to pick something up or lift something, or going down on a knee if you're working down on the ground instead of hunched over on the ground like this. All those things are going to spare the wear and tear on that back, which is going to greatly reduce your chances of having that degenerative disc set in, which is going to cause that back pain. So those are my strategies going forward for degenerative disc disease. I really hope you learned a lot from this video, more of what it is, how it occurs, and then ways of managing and working through it.